just to explain who Health Innovation West Midlands are. We are an organisation that is funded by the NHS England and also the Office for Life Sciences, and we are there to work between industry and the NHS to support the adoption of innovation. That innovation could be in the form of med tech, it could be devices, it could be AI. See, Q, yeah, AI, you are all expecting me to talk about AI, yeah? Don't ask me about catering, no good on that, unless it's brownie level, quite good on brownie level catering, but nothing else. So we are there to work with NHS partners to help them find the right sorts of innovations that are going to meet their needs. We will then work with them in that development plan, and getting something actually in. Now, we all know that that is the big difficulty. Getting things actually adopted by the NHS is not straightforward, but as one of the 15 health innovation networks across England, we are there to be your partner, either if you're from industry or if you're from the NHS, to support that process. So this afternoon, I'm going to be talking about AI within soft facilities management and kind of trying to give you some examples of where people have achieved it and what it can actually impact upon. So when we're talking about AI, what are we actually talking about? So I didn't want to get too techie too early, especially not after lunch. But there are kind of 4 main areas of AI within this space that I wanted to talk to you about. First is machine learning. Machine learning is where basically we're getting into that predictive space where the data is being churned through again and again, and the technology, the algorithm is learning and making decisions on the basis of what it is learning. It's all about pattern seeking. We don't need to get much more technical than that, but very much it is in that space about improving decision making. We then have NLP. Not the kind that will make you much better talking at people, but certainly the natural language processing. And this is very much in the territory of chatbot. So who here has used their Alexa today? Oh, come on, people. Seriously? Nobody's asked Alexa a question? Okay. Well, we're talking about chatbots. We're talking about ways of asking a machine questions with a response coming back. That's what natural language processing is all about. It's very much about supporting that communications piece. One of the more recent and very exciting elements is computer visioning, and this is really still a little bit in its infancy, particularly in the facilities management space. But this is about using facial recognition technology, tracking people within a space, looking at how it might be used in security, and we'll have a look at that a little bit later. But it's very much about using anything visionary, anything that's a visual, to make a decision. And last but not least, one you will undoubtedly have heard of, the Internet of Things. This is about devices, sensors, connecting things together to make sure that they're talking to each other and you're beginning to see what happens in real time. Certainly, this is one of the areas that supports automation. So that's your kind of beginner's guide to some basics in terms of the types of AI. But I suppose the question we all need to know is, why are we bothering? Why are we bothering with this tech? What's it going to do for us? What value will it bring to us? So the hype is that AI is going to transform the world, we'll all be out of job, and we'll all be able to go and lie on a beach all day reading the books we really want to. Anybody fancy that? Quite fancy that at the moment, yeah? Okay, unfortunately, that's probably not quite where we're going to get to. But here are a list of things that it can help with in terms of supporting your processing, supporting your work, supporting kind of the work that we can do, that we can actually take away from that routine stuff that people are doing and move it much more into a kind of a humans doing human work and computers and AI doing computer and AI work. I'm going to take each of these areas in turn and identify what it can really do. And I want to examine this by giving you some examples, some case studies from NHS locations, just to give you a sense of what it can do. Now, this is such a changing field at the moment that what I'm telling you today is going to be out of date tomorrow, next week, that sort of thing. It is progressing at a huge rate of knots. You don't need to be worried by that. What you do need to know is what use case you want it for. The biggest challenge with any AI is people not knowing what they actually want it to do. The AI, the computational bit, there's clever, geeky people who can make all that happen. Let them do that bit. If you can define the problems that you are trying to get it to solve, that is actually the very first stage. If you are an AI developer, making sure you're actually trying to solve people's actual problems is where you should be looking. It's very easy to get carried away by the tech and forget this is about making work better, more efficient, and in effect, having a better impact on people. So in terms of that efficiency and cost savings, we know that it can automate routine tasks. So things like my Alexa, bless her, him, it. Actually, mine's got a very curious accent from somewhere in the south of the world, but I'm not sure where. I ask it to play BBC Radio 4 in the morning, and it does it for me. I can set an alarm on it to do exactly that. The most useful use case I have found so far is actually collecting recipes. But what it does is that automation, so AI in supporting that automation piece, enabling that automation that you don't need to worry about, that bog standard admin. We'll come back to that as a repeated theme. There's also the element that is around prediction. And I think within your field, within facilities management, that predictive element we're going to see more and more of. So where, just in time was the Japanese phenomenon that rationalized and changed manufacturing significantly during the 70s and 80s, I think we'll see AI and automation of tasks coming in far more in all of our work. But that predictive element where it is telling you something will need to happen will be as important as the automation itself. All of this could potentially, and I'm going to use the word could a lot in this, could potentially reduce your costs, reduce waste, reduce food, reduce energy, and we'll look at some examples. So here's an example from a hospital over in London, Northwick Park. They did some work around supporting their porters with an AI portering tool. It was a solution to enable the clinicians who wanted a porter to make a request. The porter then knew who had made the request, when they made the request, what the request was actually for. That enabled both the porters to understand what they were supposed to do, but the AI solution also looks at how it will rank the prioritization of the tasks that are being fed to the porters. It's very much about producing an automated approach to it, producing something that enables fairness, so everybody knows what everybody else is doing, and it does also produce an audit trail. What then happened in this particular case is that more than 500 staff then got involved in the ED department, which has had a really significant impact on the way that the portering system works there. It's not about saving money solely. It's also not about replacing the porters. Very important that. This is about making their job more efficient, enabling them to do more of the tasks that they should be doing. And I think this is a really important theme that we need to be aware of when we're talking about AI. It's very easy for us to assume that jobs are going to be lost as a result of AI coming in. Absolutely not. AI is not at that stage yet. Current use cases are very much about increasing the efficiency and effectiveness of staff, not replacing them. What you can see there is it did save more than 10,000 hours a year, which was the hours saved because the porters were doing what they should be doing and not doing unnecessary tasks. So as an effective and efficient cost-saving method, it is certainly something to consider within that. I think what's really interesting is that one of the porter supervisors said, it has changed our lives. We have more time to do our job. And this is what I think is really important about this particular use case. As I said, it's not about replacing people. It's about enabling them to have a more fulfilling role and making sure they're doing what they should be doing, thereby increasing the efficiency. So that's one example where we're talking about efficiency and cost savings. AI is also very much involved, and we've seen much more of this recently, in that better patient and staff experience. So there's quite a lot of work that's been happening around AI sensors. They're far more used in healthcare than they once were. In fact, I worked on a project in the southwest where we were looking at a new care home which was going to be entirely AI enabled through sensors, enabling people to have a better interaction with the spaces and the people that they were with. This is also about enabling the AI chatbots and the AI patient help desks, that sort of thing, giving more instant responses. Now, I'm sure, like me, you've probably ended up on one of those chatbots and you ask it a question and it goes, I will need to transfer you to a human because what you're asking is far too complicated. And so again, this is the whole point. It's not going to do everything, but we're seeing obviously banks using them far more. Insurance companies are using them for doing the automation of routine tasks. Now, if we look at that in a healthcare setting, we could save ourselves some time and money and people's hours from the admin and the basics and put them back into providing patient care. Again, you'll see a theme. There's a lot of AI happening around portering in this at the moment. But that bed turnaround time. So do you know, can the cleaning team be told quickly where they need to go to do a bed turnaround, for example, in a hospital to make that easier? So again, an example of where this is being used. This is with University Hospital in Nottingham, I think this one is, yep. And Linden Lodge is a really interesting place. It's a neuro rehab unit. So it's basically going to be taking quite a lot of frail and mainly elderly people, particularly those showing signs of initial dementia, Parkinson's, Alzheimer's, and the like. What Nottingham did was they brought in a whole system that enabled the patients to control the environment in which they were being cared. So it enabled them to change things like moving the blinds, operating the lights, operating the temperature. All those basic things that we actually take for granted we can do for ourselves at home. But when one is in hospital, that is taken away from you and you have to keep asking people to help. And so what happened as a result is that the patients felt more able to control their own environment, but it did also save time and of the staff. They weren't running around doing some of those kind of housekeeping chores that would have been happening normally. One of the other elements that they brought in, which I think is really interesting, was one of that computer visioning pieces where they had AI-powered CCTV to enable them to understand if Mrs. Smith decided that she'd had enough for the day and was trying to get out and she shouldn't be, and to enable that security level. So as someone whose father is sitting on a unit similar to this at the very moment, this feels like a really strong use case within kind of facilities management to manage the environment for patients, manage the environment for staff, and make sure that safety and security are at the heart of it. In terms of safety and compliance, now, I don't know about you, but we all spend a lot of time doing audits, filling in records, making sure we've got the right risk records, making sure that we have completed every bit of paper that we are supposed to. And this documentation space feels like a really important one that AI can support. I'm not going to go through all of these in great detail, but AI assistants who can summarize some of the work that is required, who can support people to make sure you're compliant with things. Again, that audit trail automation, have we definitely got what we need to have? Has it been checked? Why have we got people doing checking when we could have computers doing it instead? I think there's a really interesting use case around that policy enforcement. So are people disposing of sharps in the right way? Are there ways of people learning how to better do a routine task, being supported? So not taking the task away from them, but enabling them to do it better. And finally, we know that healthcare runs on data. So those data dashboards and understanding what that data is telling you. Using AI to run those regular reports, even reviewing those reports and giving you some pointers. Saves a lot of time for all of us taking things out of one data dashboard, sticking in Excel, doing a pivot table, a couple of graphs. Why are we bothering? We could be using alternative methods. There's also an increasing interest in these automated incident logging approaches where AI is actually generating those incident reports. Still a way off in terms of being anything like mainstream, but certainly an area of developing interest. And that waste management space is also proving really interesting. So again, back to that computer vision, and I've got an example in a moment on that. But also things like AI-powered smart bins, where someone can tell you that a bin is about to overflow. So rather than necessarily having a healthcare assistant doing X, Y, Z rounds in a day, it might be that they can wait until the bin tells them they need to be emptied. Lots of different things. I think this is an area where it's still very much in its infancy. There are a few use cases, but not lots. But I think it's somewhere that the NHS could really benefit from running some real-world evaluations of how this works in practice. The use case here is a really interesting one because I couldn't actually find which NHS trust it refers to. So this is from a company website, so I'm just going to be open about that. This isn't a validated response from the NHS. This is something that a company themselves have identified. What they did was they installed a system which included real-time waste stream analysis. So looking at how waste was managing, what waste was being managed. They had weight sensors as well on the bins, understanding what was happening there, and also things like disposal patterns. So they were looking at patterns of how activity was happening. What they identified was that by using some predictive analysis and understanding the data and existing workflow, they could put in place some automation pieces and some additional AI that would better manage that flow. That included then a 28% reduction in clinical waste disposal by encouraging people to use the right bins for the right purpose. And we all know that waste is one of the biggest expenses that a hospital has. It also increased the amount of recycling that didn't have to be diverted, was managed. It gave them a much better understanding of what was happening in their waste processes across 15 different sites. So I think it's a really interesting use case. Again, very few use cases are sitting out there waiting to be read. I think it's an area of interest and one that could be looked at. And certainly as a health innovation network, if people are interested in exploring how this might work for them, we'd welcome the opportunity to have that kind of conversation. But you can see that this is a one way of kind of enhancing that safety and compliance. In terms of sustainability is a place where lots of people have been playing with AI for quite some time. Again, it's an increasing area of interest, particularly around those energy efficiency requirements and managing the spaces that staff and patients are in. We've got work happening at the moment around smart theatres, for example, which is built very much upon the green theatre agenda. So where we're trying to minimise waste, better use resources in theatres, moving from that green agenda into smart theatres is certainly something that's happening. And in actual fact, we're working with an innovator locally in the West Mids who has developed a product that is used in a number of different sectors, just not health yet. And it should enable, their use case that they're examining at the moment is that smart theatres piece. So how can we better use theatre spaces? How can we power theatre spaces down safely and bring them back up to reuse safely? So there's some really interesting pieces of work to be done there. But as I said, it's somewhere that is happening quite a lot. So the QE Hospital in Kings Lynn has actually done quite a lot of work around its energy optimization. So it was using a specific element of an analytics platform integrated with sensors across the various estate pieces to understand what is happening, interlinking with the building management system and able to actually do some forecasting and prediction around when energy use would be in its highest. At the moment, they are saying that they've reported around £100,000 in annual savings. Now, I don't know the cost of implementation, but you can see that over a period of years, you are likely to start seeing some business cases where your money is indeed coming back. I put the bottom one there as well. It's not a specific hospital, and it's actually from the World Economic Forum, which I thought was really interesting that they are interested in this as a major element within kind of the economy of healthcare. So what they identified is that using a study by an internal company, so we had to take the figures slightly, with a pinch of salt, they were able to reduce their operating room energy bill by 25%. So again, you can start to see how actually the business cases are really beginning to stack up in this space. And last but certainly not least, this whole issue of workforce productivity. So I've talked about the portering services and how they operate. I think we're all seeing, are you seeing them on your Teams meetings when somebody's otter pops in and joins a Teams meeting? Always throws me slightly. I have this vision of a little otter sitting there with a pad and pen. Clearly not. But there are those things that we can all be using in our daily work just to support our productivity. There's a lot now beginning to happen in that automated scheduling, again, primarily in a clinical space at the moment, but there's no reason why that wouldn't branch out into other areas. And also those kind of practical applications using robotics, which is obviously Lisa's area of expertise. The use case here, the one I picked was one from Suffolk and Essex, which was basically where they had a joint project with a company to do cobotics. So not just have little Johnny robot running around. I did say I do interpretive dance, so that's my interpretive dance moment. But actually having it with the member of staff so that the member of staff does the deep clean, does the intricate cleaning, does the very necessary other cleaning that the robot can't cope with, but the robot does the generic. And I think there's something really interesting in that model around how the person and the robot comes together. It's not supplanting one with the other. What we see there is that the senior Soft FM manager, very pleased with his work, you can call it an ambassador, but importantly, by releasing the staff member to undertake other cleaning, it has enabled a better standard of cleanliness right across the board. So that joining of human and robot, human and AI, I think is really important. So just to finalize this session, what's next? So I would suggest that the future of AI is about moving from reactive support services into that much more intelligent, predictive, integrated, sustainable, automated, making it part of the hospital ecosystem. We've seen a huge increase in the amount of AI use in clinical systems. What I think we're now beginning to see is that actually filtering into the parts of the hospital that are so incredibly important, but often not viewed as such. Looking at that kind of hyper-automation, so making sure that lots of tasks are automated. Enabling that CCTV, that sensor work, ensuring that we're getting to that predictive safety and compliance. Clearly, lots in that sustainability piece, and ensuring that sustainability will actually genuinely make a big difference to our hospital estate. Supporting our support staff, so looking at AI assistance. And then finally, when we get to that new hospital, if we ever actually buy a new hospital, when we get to a new hospital, ensuring that all of this, which is starting to happen, is built into the very fabric of the building, the very operations of the building from day one, rather than just an add-on. So just to summarize, AI has obviously a clear role to play across the whole of health and care. Particularly within the area of interest for today, I think there are some really exciting developments, exciting use cases that have already happened. What will be interesting to see is how we move from now, say in 3 years' time, 5 years' time, to that becoming the norm. And what do we need to do to enable that to happen, both from an NHS perspective, but also from a commercial perspective. AI is not going to take all the jobs, not yet. You're not going to be lying on your beach reading the book quite yet. But I think it's really important that we start to embrace it, explore it, and are really honest about what it can and cannot do. So finding really effective use cases that will make a difference to both staff, patients, the estate, and all of our jobs will be what we need to focus on. Thank you.